Yeah, well, I think a super important piece to this is that there is, I'm going to call it a relatively non-predictable course of therapy across a population, which is really something that the poster speaks to, is that the disease can manifest in a number of different ways. However, there are some, you know, some certain hallmarks of this. I will say that, you know, neurological issues primarily, you know, seizures, epilepsy that need to be treated with anticonvulsants. That is sort of the primary hallmark condition that exists, and probably a good well over the majority of these kids do have some sort of neurological issues. Then in conjunction with that, there are broadly gastrointestinal issues with these children, which is everything from the ability to feed or the inability to take in food. So some children wind up getting diagnosed with something close to, failure to thrive, maybe dehydration or malnutrition, as well as they have issues relative to gastrointestinal motility, which really lead to some problematic cases of constipation in these kids. And one of the reasons why the constipation can be a major issue, especially for these children, is if they have an inability to communicate, they can potentially have a significant issue with that constipation. They do have some, nausea, vomiting as well. Some of that's very much related to feeding. And then you can look broadly into orthopedic disorders. So as a result of, again, the neuromuscular related issues, some of these children have an inability to walk. Some of these, maybe they can walk with potentially some DME aided walking devices, but they have issues with their gait. They have issues like scoliosis. Many of these kids have scoliosis. So those are probably, I'll say, the three major, organ group type of manifestations that they have. There's also some endocrine types of disorders that do show up, which may or may not be related to some of the other, organ system issues we just discussed. But I think that at the end of that, what's very important to understand about these kids is they receive a myriad of therapies that are not just costly, but they are also time intensive. And one of the things we did report out on is the significant use of a multitude of therapists. I mentioned before, occupational, speech, physical therapy. These children have a multitude of needs that way. And when you look at healthcare resource utilization, that's something that jumps out off the page at you in terms of how much of this therapy many of these children actually require to gain the skills for activities of daily life. So I think that that's one of the major pieces to this that really kind of needs to be understood, is the broad burden on not just the patient, but on the family dealing with Rett syndrome, the caregivers, mom and dad.